So we begin week 3 already.
It's going by so fast. So fast.
Mm-hmm. It's going by really fast. I can't believe it's the beginning of week 3. Cannot believe it. Okay, we'll get started. It's 3 o'clock. We're still waiting for 1 or 2 more students, but hopefully they come on in. If everybody could turn their cameras on their faces. I'm looking at a lot of ceilings and a lot of walls. Okay. So, Jalacia, can you turn on your camera, please? Okay. All right. So, welcome to week 3. Hard to believe it's week 3. Are you guys getting organized with the rest of your classes? Do you have a plan to accomplish everything? Now that you've had introductions, a couple of weeks of classes, you know your syllabus, you know your assignments for all the classes. Are you feeling like you're getting organized?
So I got one thing
Oh,
that it made me a little bit nervous, only because being that you are my teacher and I'm so used to your technique so far, I printed out the reviews for the exam reviews, right?
okay.
Cuyahoga Falls have med surge on Wednesdays from 1 to 4:20, and then we go straight into sim. So we on campus from 1 to 8 o'clock at night and can't sit for your live session.
I was thinking about, um, I have the master schedule of all the PN classes, all
Mhm.
the everything you're taking. And I
Right.
have it says when you're in labs, when you're in clinicals, when you're in sims, and I tried to pick the day that is least interrupted. But there are a couple of campuses that are interrupted that day. The one thing I was thinking about doing is maybe doing my review on that morning,
Okay.
on that Wednesday morning. Would that help you guys out?
I mean, to speak for me, it's better
Because
because I don't.
Cuyahoga Falls is one of the impacted campuses. There's only a couple. Other days, there's like every campus is impacted. So I didn't want to waste my time doing a review on those days.
Right.
So um, I'm happy. I'm happy to go in the morning. Do others have conflicts in the morning?
What
This
Wednesday
Wednesday,
is it?
right? This
It would
Wednesday?
be this Wednesday, yeah.
Oh, I'm good on this Wednesday. I don't have nothing to do.
Okay. If I change mine to Wednesday morning, would you guys be able to attend?
Yes.
Yeah.
Okay.
Well, for me, I know I can. I don't know about everybody else.
Can or can't? Can or
It's fine with
can't?
me.
Can.
Can, because you have school-related activities or work or what?
What time Wednesday morning?
I don't know. I mean, I can do it whenever. What time do you guys go to class? You said you have a full day. What time do you go?
Oh,
We gotta be there at 1.
One.
Wednesday morning.
What about like
We
9 o'clock Wednesday morning? 9 or
Yeah,
10
I'm
o'clock?
good. I don't have nothing that day until next Wednesday. So I'm good.
What
I
about
can't.
Sierra? What about you? Could you do a Wednesday morning?
Oh, that's perfect.
Okay. Maybe I'll change mine to Wednesday morning. For those of you at work, I mean, the review's usually a half hour, 40 minutes. if you could maybe schedule a break around that time. It's up to you. Why don't we just plan on, I'll make myself a note. I'm gonna change my review from, what time is it now? 3 p.m. Eastern time to 9 a.m. All right? If that
9
will
a.m.
help.
Eastern time.
So that'll
Right.
be 8 o'clock. Wait, 8 o'clock
So-
here.
Yeah, it'll be 9 o'clock Eastern time, so 8 Central. Okay? I'll
Will
plan
the
on doing,
review be, will
the
the
other-
review be recorded?
what?
Will the review be
Yep.
recorded for those that can't?
Yep, absolutely. All three will be, let me share my screen. I sent it last night in the announcement, but let me just share it again so we can all make sure we know the dates. Okay, so I'm gonna change mine to, well, I won't do it here, but I'll update it and send it back to you. So mine will be Wednesday, the 26th at 9 a.m. Eastern time. Okay. Professor Ford is going to do hers the next day, Thursday, the 27th at 5 p.m. Eastern time. So that's 4 Central. And then Professor Kershaw will do hers on Sunday, the 30th at 6 p.m. Eastern time, which would be 5 p.m. Central. Okay, so you have the opportunity to attend 3 live reviews, and then you'll have all 3 recordings as well. And so you won't get Professor Kershaw's till Sunday night, and you guys will be taking your exam on Monday, but I will make sure I get that out to you Thursday, or excuse me, Sunday night. All righty? Questions on that? Everybody, if you haven't already, this week, I would double check ExamSoft, your ExamSoft account. Make sure you can get in, make sure it's all working so that we don't have any issues next Monday. Okay? I will open up the exam to download next Monday morning. I don't do it until an hour or 2 before the exam. But I'll send you an email next Monday when it's ready to download. So this is a 3 p.m. class, so you'll be able to download it at 2 p.m. Okay? And then please, if there's any issues that you're not going to be able to take the exam, if something comes up or whatever, please get in touch with me over the weekend or Monday. Okay? Unfortunately, you guys are an early class in the week, and so exam grades won't be posted till Saturday. Okay, and I can't, as you know, I can't give any preliminary results, so you have to wait. And we wait till all sections are complete, and there's actually a Friday night section. So we'll get together and meet. We usually meet mid to late morning on Saturdays, and then we'll get those grades posted on Saturday, hopefully early afternoon. Okay? And then next week's announcement, we'll go over just the kind of the guidelines for exam taking, which you should be familiar with, but I'll send that in the next announcement. Okay? Questions so far? I did send out last night. It was attached to your announcement. The review. Week 3, right here. Okay, this was attached to your announcement last night. It's your concept guide for exam 1. You can call it a study guide, you can call it whatever you want. I'm calling it the blueprint concept guide because I'm basing this, organizing this based on the way the concepts are set up for the exam. And it's just like we've been going over the last 3 classes, last 3 weeks. I don't know if it's helpful, but I have copy and pasted all your readings. I'm just going to give you a real quick review here. I've copy and pasted all your readings from week 1, week 2, and week 3 in there to help you. Okay. Standard, multiple choice, select all that apply, fairly basic math problems. I sent you in week 1 a YouTube channel training video from Professor Bogart, pediatric professor, who does a very detailed, very basic math tutoring session. And so you can go back to week 1 if you struggle with math, go back to week 1 and find that announcement and go ahead. It has worksheets that go with it. So go back and review that. Okay. This exam review comes from the blueprint concepts that are going to be covered on the exam. It comes from the 3 weeks of weekly notes or weekly blueprint concepts that was sent to you. It comes from your readings, and it comes from lecture. Okay, so a lot of this you'll have seen in your 3 weeks of notes, but it's a review. Okay, so I start with week 1 concepts and go through the 4 that we looked at: Introduction to Community Nursing, Levels of Prevention, Healthy People 2030, and our Introduction to Vulnerability. Those are the 4 concepts we covered in week 1. And in week 2, last week, we covered school nurse, growth and development, and then common childhood ailments. Okay, so those are all in there. And then family nursing, family health risks. And then this week, we're going to cover migrant farm workers, rural population, and then these are called special vulnerable populations. Migrant farm workers, the rural population, and then homelessness and poverty. Okay. So your notes for each week are very detailed. Okay. I have summarized in the review guide all of these topics for you. Okay, so the review guide is not anything, it's not introducing any new material. It's summarizing and giving you a snapshot of each of these concepts we're covering. Okay, so between what I would be preparing for your exam is using the review guide that I sent last night, and then I would be looking at your 3 weeks of notes. Okay, everything should connect. Make sense? That's where I would start. If you go through the review guide and any of these 10 concepts you don't really understand, go back to the week that you have the notes in and read the more detailed version. Okay? If at the end of studying, you attend review sessions, you watch recordings, if for some reason with any of these 10 concepts you're struggling with, please reach out to me at the end of next week. Okay? Over the weekend, next weekend, and we can set up a Zoom time to review any of these 10 concepts that you're still unsure of. Does that make sense? So that is my suggestion on how to prepare for the exam. If you come to a review, I'm not going to be going back over the 3 weeks of concept notes. I'm going to be focusing primarily on the review guide. Okay? So that's my suggestion of how you attack the exam. If you have a good understanding of the guide, exam 1 guide that I sent you, and you can apply it. You can apply it to clinical settings, a migrant farm worker, a group of in the rural population, a homeless person, a family or an individual who lives in poverty. If you can apply the knowledge to the setting, the clinical setting, you're going to do absolutely fantastic on the exam. Does that make sense? And in the review, we'll go through examples. We'll go through actual clinical scenarios. Okay? Questions about that? And in the exam reviews, at least for me, I go over test taking strategies, do's and don'ts, just what I've learned over the last 3 years from myself reviewing exams and from students that I meet with after exams and the feedback I get. All right. So I wanted to point out, I'm going to use our week 3 notes because that's where I've summarized a lot of the book reading or a lot of the Canvas reading. But I wanted to point out to you that oh, no, I have to share my screen. Hang on. Share. I want to point out that all of your readings from this week, every one of them, there's no book reading this week. It's all in your module. Okay, so please, please, please review these as well. Now I've put together these concept notes based on this and some other information. So it shouldn't be, like I said, everything's connected. All right, but please take a moment to read these 4 teaching sheets because these are the 4 topics we're covering today. Okay, so let's go through, let's go through what we've got going this week. You have an NCLEX assignment. Everybody know that? You have an NCLEX assignment due Sunday. Again, if you have a minute to start on it early in the week, if you score low, you can review, look at rationales, take it again, and submit the highest score you can. It's a learning exercise. There's a reason why we do these NCLEX assignments. They're very helpful in preparing you for NCLEX. All right. And then I know it says begin working on vulnerable populations. I don't know if you have, but it's just a reminder to be thinking about it. Okay, and then after we go through the content, we'll do quiz 2 today during class. The one thing that I would also like to point out is after this week, it's kind of a pause week and we have an exam. This would be a great time to update your HESI prep assignment. Does that make sense? Let's see, hang on. Where's my HESI prep assignment? I do want to pull that up, so hang on for a minute. I can't put my finger on it quite on my desktop, so go into our week 1 announcement. Okay. There's a lot of this that can be filled out after this week. Okay, there's a lot. You can start to fill out health promotion, health teaching, patient education. You can start to fill out this vulnerable population section, right? The migrant farm workers, rural, homeless, poverty. Okay, so you can start to fill this out. Alrighty?
Are we just defining like each topic or?
You are thinking about each of these with regards to the nursing process. Okay, so if a patient presented to you with potential anthrax exposure, what might that look like? through the nursing process. What might they present with? How is it treated? How is it transmitted? How do you evaluate whether the treatment's effective? So it doesn't need to be a long book for each one. It just, you are going to get a question on your HESI about anthrax. Every box in that HESI prep represents a question on the HESI. I don't know what the question is because I don't do the HESI, but I know what the topic is. Does that make sense? Okay. All right. Let's talk about migrant farm workers. What did you learn in your preparation for migrant farm workers for this week? What makes migrant farm workers so vulnerable and so unique?
A lot of them are not from the country, actually, so they may not speak the language. And
Yep.
a lot of them can be undocumented as well. So, and they doing the work that other people won't do. I know I won't go out in no hot sun or no cold and pick no kind of fruit. So they doing that
And they're seasonal too,
for
right?
less money, and it's not. They probably barely getting any money. Like, I don't know how much it is, but because I know they go probably by the pound or however many they picked or something like that. So they probably there sun up to sundown, trying to make ends meet.
They exposed to the sun a lot of things like mold and things like that, depending on the condition of wherever they live in. It's more like a farm base, like it ain't insulated like our homes and things like that. Stuff that they kind of actually built together without all of the things that they really need for stable living.
Right.
And they also can expose to more chemicals, because I know that some areas you got to spray, the fruits to keep the bugs away, and sometimes the chemicals can make you sick. So
Well, what's the number one risk for exposure for migrant farm workers? Pesticides.
yeah, pesticides. I couldn't get it. Yeah, pesticides.
Pesticides. Then think about these workers. They're seasonal. They're moving around a lot. Maybe
They
they're
got
traveling.
families.
Maybe they're traveling with families. Typically, their housing setups are not very good. So this is a special vulnerable population. So they come to the U.S. to work on farms, and then they go back home. They move around a lot, like we said. They typically don't know what services are available to them. Often there's language barriers. So accessing healthcare can be harder. They typically don't have transportation. And we know that female migrant workers are more exposed to sexual harassment and abuse. For the kids working on the farms, and they do, as horrible as that sounds, they do. Kids are exposed to pesticides, maybe injuries from equipment, pesticide exposure we talked about. Even though kids may be performing short and simple tasks, they still may be out in the sun all day, but they are exposed to a lot. And we do what?
Bites from animals.
Absolutely. Yeah. We know that our food supply in the US would collapse without the work of migrants, right? They're kind of the unseen, unheard part of our society. It's estimated that 2 to 3 million of these workers are seasonal. Okay.
Not only that, besides doing our fruit and stuff, some of them, they build our houses, build our companies. So yeah.
Absolutely. Median pay for a migrant is $20,000, which is below the poverty line. And the one thing that's important to know about migrant workers, and I think this is on your exam, migrant workers are not eligible for workers' comp, disability, health benefits, retirement benefits. I mean, these jobs don't come with health insurance, dental insurance, right? These are
Right.
daily or hourly paying jobs. And so if you've got a migrant worker that's sick, they're much less likely to take the day off and go get taken care of, right? They don't want to miss a day's pay. They're not eligible for any of the services, right? When they typically arrive, they found out that the housing is substandard, maybe sanitation issues, structural issues, mold, lead, lack of AC, maybe living in crowded conditions. I mean, some migrants, they even live in their cars and tents. Housing is overcrowded. What does that contribute to? Communicable infectious diseases, particularly TB, GI disorders, hepatitis.
Not getting enough ventilation.
Yeah, yeah. They're so exposed to high levels of pesticides, herbicides. It's a threat to all of them, everybody in their family, especially if their children are with them. And so, based on that, we know that migrants are at a high risk for chronic diseases, okay, such as diabetes. It's common for them to have poor dental health. They don't have any dental coverage. Common for obesity to be a health risk, depression. Think of what they're exposed to. And these kids, what are the risks for the kids? Risks of malnutrition, infectious diseases, dental issues. Maybe they're not up to date in their immunizations. Pesticide exposure we talked about, injuries, and then academic disruption. Okay, they're always moving around. There is what we call a Migrant Health Act. Okay, so please know about that. It's right here. It's the last paragraph. Migrant Health Act provides primary and supplemental health services for migrant workers, including outreach clinics. There are migrant health centers. They're federally funded clinics while the workers are in the US. Right? These migrant health centers, there's 154 of them. They're in 42 states and serving approximately 3 million migrants. So at least they have that. But what if you're working in an area that is not close to one of these centers? Okay. So that's our migrants. Rural populations have a lot of similar risks and barriers as migrants, but there are some differences. What's rural? Anybody live in a rural community, or a family or friends that live in a rural community? What do you know about the rural community? What is it?
My grandparents and my cousins, they do. So they have to drive like from Wilcox County to like Montgomery. That's like an hour away if they have like something majorly wrong with them. Or they'll go to Selma, Alabama, which is like 30 minutes, I believe, 45 minutes away, to get like care.
Right.
Or they do, well, now they got well, my sister did it for my mom, not my mom, my grandma, what's it called? When now you can go to the doctor on the line now,
Oh,
online now.
telehealth? Telehealth?
Telehealth, yes.
Mhm.
So they can do that.
Yep. That's certainly increasing in the rural areas. I mean, think about the rural population. Do you think they have more services or less services
They have
available?
less resources.
Less resources.
They
Way
don't have
less.
like
Yeah.
full grocery stores like we do. They have like mini markets or like a
They
family
gotta go 30
dollar or
minutes
something
away.
that may have, like a small market into it.
Mm-hmm.
A Walmart is probably like anywhere from 45 minutes to an hour and a half away from them.
Yeah.
Healthcare, they have to, go past
Rely on clinics.
towns to be able to get to, not even just in an emergency situation, but a physician's office visit. It's not, most of them don't have like local places.
Right. I mean, really, if you're thinking the rural community, maybe you have a family physician. It takes care of
They
everybody.
Yeah, they used to. I know they used to, but he done retired, so yeah, they don't have that anymore. They used to now, cause I remember I used to hate going there because I was like, y'all gotta go so far to do stuff. So yeah,
Think about if you're a rural health nurse. Think of all the responsibility you have. I mean, you may be the school nurse, you may be the clinic nurse, you may be the labor and delivery nurse, I mean, rural health is very challenging, right? So rural may be considered a farm, village, very small town. Okay, certainly not anything like the metropolitan areas. Okay, in the last decade, there has been a shift of people moving from urban, large metropolitan areas to the less populated rural areas. There's lots of vulnerability in the rural areas. Okay, they tend to have a higher proportion of residents that are either under 18 or over 65. They have fewer years of formal education with fewer college degrees. And then more than 25% of rural Americans live in or at the poverty level, live below or near the poverty level. And that means that 40% of all rural children are impoverished. Most at-risk are children, racial and ethnic minorities, and single-parent families, especially single-parent families led by women.
some don't really have health care
Well,
because of their
that's the next
jobs.
one. Fewer residents have insurance or adequate insurance. Right. Very, very low rates of insurance coverage. The one thing we know for sure is that rural residents are much less likely to prioritize their health and engage in preventative activities. They don't go see their primary care every 6 months to every year. They're more likely to smoke, have higher rates of alcohol use, obesity, and they're, as we said, much less likely to engage in screenings and wellness visits, which means they are much more likely to have chronic illnesses, heart disease, COPD, hypertension, diabetes, cancer. It's estimated that 50% of all rural adults have been diagnosed with some kind of chronic condition, as opposed to 25% for non-rural. That's huge. So when we finally do see these rural clients at the clinic or urgent care, are they more likely to be in their advanced stages of whatever condition or disease that's
Yes.
brewing? Absolutely. Which hence, that's why one of the biggest healthcare costs across the country in the rural communities is chronic diseases. Okay, as we said, they tend to have overall poorer health, less likely to seek medical care, less likely to have health insurance, and certainly less access to physicians. Again, you may have a family physician or one primary care physician. Who knows what their specialty is? There's no high-risk OB, there's no oncology, there's no neurology. You're having to travel to the next largest city for those services. It's also estimated that only 10% of doctors work in rural areas, even though 25% of the population lives in rural areas. That's crazy. And then we also know that when they do get sick, we're the rural population, they have much more difficulty maintaining independence because we just said the distance they may have to travel in order to receive specific services. And there's a big lack of public transportation in the rural areas. And there's certainly a lack of services, specialty services. We do know that rural populations also have a higher infant and maternal morbidity rates, especially in areas with poor physician coverage. I mean, in rural areas, they're not going to have a pediatrician or OB specialists.
I had a patient once that, like, what we call it here, living up the country. And this specific patient lived up the country for like since birth to probably like the age of 12 or 13, and then was transferred to another family member that lived, in the city. And that child at the age of 12 or 13 had never had a physical exam, a well child exam, dental, nothing.
Probably had
And
no immunizations.
nothing.
Wow. Wow. Yeah. We touched a little bit upon the rural population with regards to mental health issues, high levels of depression, very much at risk for stress-related conditions, especially if you're in the rural population and you live in poverty. A huge factor. There's 4 industries that are high risk within the rural areas: forestry, mining, marine related fields, and agriculture for farming. Why are these high risk? Machinery, accidents, car accidents, trauma, cancer due to exposure, allergies, respiratory conditions, chronic illnesses, birth defects, maybe developmental delays due to chronic exposure to pesticides, toxins. We already talked about this, but farm workers have the following health risks: pesticide exposure, heat sun exposure, hazardous tools and machinery, infectious diseases, musculoskeletal injuries. Think about lifting all day. This paragraph actually belongs up in the migrant section, but it also could be applied to the rural, because if you're working out in a farm or you're working in the mines, you have the same risks. One thing I would like for you to know is I'm actually going to move this whole section. Just doing this for my own. One thing I want to jump back to with regards to migrant workers is this acute pesticide right here. I need you to know what acute and chronic pesticide exposure presents with. Okay, because in these two populations, migrant farm workers, rural population, pesticide exposure is the high. There's a lots of exposures, but pesticide exposure is the most at risk. So what's the difference between acute and chronic? Okay, so we need to know this. You need to be, if you're given a scenario in the exam of somebody presenting with whatever symptoms, is this a sign of acute pesticide exposure or chronic? So acute, memory loss, difficulty concentrating, mood changes, abdominal pain, nausea, vomiting, and so on. But chronic pesticide exposure, chronic we would mean over several years. Maybe birth defects, cancer, blood disorders, neural problems, reproductive issues, Parkinson's, infertility, sterility. Okay? So know the difference between a patient who presents with a pesticide exposure. Are we talking acute or are we talking chronic? Somebody presenting with risk, a diagnosis of cancer. That's a chronic exposure, right? Because that's been happening over years. Make sense? Okay. Let's move to our homelessness and poverty population. So when you guys are driving down the street, taking a walk through your neighborhood, on a bus, on a train, and you see a homeless encampment, what do you think of? What do you think about? What are your initial thoughts?
The weather conditions that they're living out in.
What
Hello?
else do you think about?
Not getting treated for like any wounds or stuff like that.
You can
Hard.
think about also what put them in that situation.
Mm-hmm.
I always just figure out, I mean, be trying to think like, do they even know the resources that homeless can get, or where they gonna get their meal from? And I mean, we went to Tennessee this past fall, and to see the children that was out there with their moms with blankets, I felt uncomfortable to eat at Ruth Chris. And Thanksgiving time, they was giving out all of these dinners to everybody in packages because they had too many, and I got frustrated. So I asked the man, could we have them? And they had them in these fancy containers. It was a dessert. It was a whole layout for Thanksgiving. And he ended up giving us about 30 of them. So instead of us going out in Tennessee, we rode around the downtown area and just gave all of them dinners and stuff like that. And I felt like for the owners to give it to us, he should be ashamed of himself, because just like we rode past all these people to get to this restaurant, he see it every day.
Thank you for sharing. Homelessness is a huge issue in this country.
Yeah, it's a reason. It's a reason why some of them don't. It's a reason why they don't give out, food like that anymore. So a restaurant got sued for that because the homeless man said that he got sick. So they don't want to get sued, basically. So because I used to think the same thing, like y'all got all this food, so they don't give away. They have to just throw it away.
Every one of our communities that we live in has a homeless population, does it not?
Yeah.
What I
Yes.
really struggle with driving around my community is when I see the families with young kids. And I know during the pandemic, when I was working in the schools, there were a lot of families who went from not being homeless to being homeless during the pandemic when parents lost their jobs and everything kind of shut down. The family homelessness is increasing exponentially across the country right now. So before COVID-19, the percentage of Americans living in poverty was the lowest that it had been since 1959. It was at 10.5%. Okay. After COVID, it climbed to 17.3, 48 million Americans. And the child poverty rate increased to 21.4%. So 1 in every 5 kids was living in poverty or is living in poverty. And poverty is defined by the federal government, right? They call it the federal poverty line. A family of 4 making $24,000, 300 is at the federal poverty line. Okay, there's lots of services, programs for those living in poverty. Public housing, food stamps, Medicaid, WIC, Head Start. And what does it mean to be poor or poverty? What it simply means is having insufficient resources to meet your family's needs. And the basic family needs that we're talking about are food, shelter, transportation, and healthcare. And how many people do you know that have insufficient resources to meet all the needs? I know people. I know families in my schools. There's a lot of people who don't have the means to provide these 4 needs. Other contributing factors to poverty: unemployment, maybe loss of retirement benefits if a company closes or files for bankruptcy. Maybe weak enforcement of child support statutes, outsourcing of jobs, and the increasing number of kids born to single women, particularly teens. This section is about poverty and homelessness. We know that poverty leads to chronic stress, mental health issues, higher rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, disabilities, and certainly higher rates of hospitalization. Chronic healthcare problems lead to huge expenditures in the hospital. And maybe it also leads to more stress on the family, more financial stress on the family. Okay. Young kids are at the highest risk for the effects of poverty. Remember that. Young children are at the highest risk. They are the highest risk from the effects of poverty. Maybe it affects their nutrition, poor brain development, exposure to environmental toxins, trauma, abuse, low quality daycare. They're likely to have more chronic diseases, more nutritional deficiencies, maybe growth issues, developmental delays, more infections. And they're usually stuck in poverty cycles themselves due to decreased education and opportunities. What about the teens that live in poverty? Poor teens are more likely to have below average academic skills, and they are 3 times more likely to drop out of school. There's a much higher rate of teen pregnancy and much higher rate of suffering or having complications with your pregnancy due to maybe lack of prenatal care, low birth weight, premature babies, or babies with birth defects. Let's talk about homelessness. What might lead to homelessness? I mean, think about it. Everybody has a story of how they got there, right? It could be unemployment or being laid off. They don't have
Sometimes
a
it can be your,
go ahead.
sometimes it can be mental status.
Mental status. Absolutely. It's right here. Substance abuse. Yeah. They can't afford rent for their family. They've lost access to the health care. Maybe they have a chronic disability. Maybe they're in a health crisis, acute or chronic mental illness. Maybe that leads to their loss of income. Maybe they don't have social support systems. Substance abuse. That can lead to job loss, financial difficulties, especially if the substance abuse becomes more important than anything else. Domestic violence.
Sometimes,
Go ahead.
sometimes also by choice. Some people just say, forget it, I want to stay on the street.
Absolutely. Absolutely. A lot of women end up in homeless situations because of domestic violence. Right? They leave a abusive relationship, have no support, and they're on the streets. Often with kids. And believe it or not, homelessness just doesn't mean people living on the streets. We saw a lot of this during the pandemic. Homelessness also means people or families that are staying with friends and relatives, staying in temporary shelters, staying in institutions with nowhere to be discharged to. That's still considered homelessness. I saw a lot of this in the schools during the pandemic, families moving in with relatives or friends. They were then considered homeless. With regards to homeless, they're living on the streets, they're exposed to a lot of elements. Overcrowding, unsanitary living conditions, malnutrition, sleep deprivation, chronic stress. They're much more likely to use substances, abuse substances, have serious mental health illnesses. The risk of communicable infectious diseases, TB, skin infestations, chronic illness, maybe victims of crime. Trauma is also a major cause of death and disability with the homeless population. Gunshot wounds, stab wounds, head trauma, attempted suicides. This is incredible. The average life expectancy of a homeless individual is 44 years old, as opposed to 78. That is just an incredible statistic. So what can we do? Okay, as nurses working with the homeless population, it is vital that we respect the individuality of every person. Many factors contribute to homelessness, and many of us are only a few paychecks away from being unable to maintain our housing costs. It's easy to stereotype, but we're often going to be wrong, right? No reason to stereotype, because we are going to destroy any chance at a trusting therapeutic relationship with this vulnerable group. Okay, we can't make assumptions. We have to let them tell their story. How'd they get there? Who are they? Okay, so establishing that rapport, that trust, that compassion, the kindness. Without that kind of relationship, they are not going to open up to you. And especially if you have a mom with kids, you really need to have this mom trust you so that you're trying to get appointments for her kids to see the doctors and whatever. This population typically doesn't open up and talk to anybody about everything. You have to establish that therapeutic communication, therapeutic relationship. Then here's some examples of primary, secondary, and tertiary for what we've covered today. So on a farm, teach ways to avoid pesticide exposure, right? Advocate for childhood immunizations in migrant farmer kids. Advocate for better living conditions of the rural migrant farm workers. Secondary, remember secondary screening. Screen for evidence. This is in general, this would be for poverty. People live in poverty. Screening for evidence of financial instability, especially those with chronic health conditions. Maybe yearly blood pressure, blood glucose checks. Educating on the importance of scheduling cancer screenings, pap smears, colonoscopies. Tertiary, they already have something. Providing guidance on non-pharmacological management of lower back pain. Helping a homeless client find and apply for resources. Referring to the health department for STDs or HIV treatment or management. Be teaching a client how to take their medications. Help them find low price cash payments for medications. Maybe educating on side effects of the medications they're taking. Does that make sense? Does everybody understand why each of those are primary, secondary, and tertiary?
Mhm.
So that's a summary of our 3 topics for today. Do you have any questions on rural population, migrant farm workers, homelessness / poverty? Okay, so that's it for content for the first exam. Okay, so you've got your 3 weeks of blueprint notes and you've got your study or your review guide. I'm going to ask everybody, it's almost 4 o'clock. So I'm going to ask everybody to pull up quiz 2 and start taking quiz 2. I'll give you about 15 minutes. We'll go till about 4:15. How's that? So you've got about 18 minutes and then we'll come back and review it. And you got to stay on camera. Okay. You got to stay on camera to take the quiz. So go ahead and pull it up and start it and we'll see you in about 15, 17 minutes. Okay. Okay, looks like everybody's done. Where's Crystal? Crystal, I need you to submit. Are you all done? Crystal? Okay, looks like everybody submitted. Okay, so let's go over this. And if you notice from the questions, this is more clinically focused, right? Taking your information and trying to do an assessment on a clinical patient presenting with different things. So let's go through this. Share my screen. Okay. Can everybody see my screen? Okay, so these are the correct answers. What should the home health nurse anticipate about clients in a very rural community? Did you guys get this right?
Yes.
Anybody not get this right? We talked about this. They are much more likely to have complex chronic illnesses. Why?
They don't get to the doctor until late.
Right.
Not being able to get the services
Exactly.
on time or whatever to get a checkup, annually or monthly or whatever.
Yep. And then most of them will have employer provided insurance. That is not true. They will be less likely to have environmental chemical exposure. No, that's just the opposite. They're going to be more likely. And then most of them will have adequate access to physicians. No. So the only correct answer was they'll be more likely to have a complex chronic illness. By the time we see them, they're going to be in the more advanced stages. Okay, so the nurse is developing a primary prevention program for members of a rural community. Which intervention is appropriate? What's primary?
Education.
Well, yes,
Prevent, you
Uh,
want
prevention,
prevention, yeah.
prevention, right. So did everybody get this right? Right, we're providing information ahead of time to try and minimize sun exposure. What's A? Encourage adherence to a routine pap smear. What level is that?
Tertiary.
They're on some schedule for they already had something is going on, so they're getting routine.
Well,
Well,
A is going to be secondary because it's a screening,
right.
right? Educate families on diabetes related foot care. Well, they already have diabetes, so that would be tertiary, right? And then the last one, organize a blood pressure screening at a local mall. That would be secondary, right? That's a screening. So the only primary was B.
Right.
Migrant farm worker presents to the clinic complaining of eye irritation, throat irritation, and a cough. Which nursing intervention is appropriate? What are those three symptoms? What could those three symptoms be related to? And what do you know about exposures to migrant farm workers?
Pesticide.
Those are
Something
potential.
that irritated.
Different chemicals and stuff like that.
Yeah. Those three are common symptoms of pesticide exposure.
It's the acute phase, right?
Acute exposure, yes. It's not, these aren't signs of conjunctivitis. And we don't know that request a physician's order for an antihistamine. You really don't know what's going on. We're not going to treat pesticide exposure with antihistamines without a doctor seeing the client, right?
Right.
And we're really not at the point yet where we have to complete a TB screening questionnaire. These are symptoms of pesticide exposure. Okay, during a home visit, the nurse notes the migrant farm workers are living in a small house with several families. Which nursing assessment is a priority? Important word. So this question is a good example of if there's more than one answer that looks correct or could be correct, then, and you can only pick one, and this goes for exams as well, go back and read the question and see if you missed an important cue or word or phrase. Here it's asking you which nursing assessment is a priority. So I don't know, A, access to consumption of nutrient-dense foods. I guess that could be a correct answer. But look at D, TB screening symptom questionnaire. Why?
Because they're in a large group, it's a large family living situation.
Living in a very crowded, small house.
And it could spread.
Exactly. So what's the priority? First and foremost, TB screening. Okay. Which statement reflects the impact of incomes on health outcomes?
Low income increases the risk of chronic illness.
Correct. Right, we talked about this, living in poverty. Low income increases the risk of chronic illness. The other ones don't make sense. Low income guarantees access to Medicaid. It does not. High income reduces attendance to wellness visits. That's just the opposite. It increases the attendance. And high income does not improve health outcomes. Yes, it does. Okay. So low income, did anybody get that wrong? Which should the nurse anticipate for a family living just above the federally defined poverty line?
More issues. It was going to be A.
Yep. They're still going to have increased vulnerability due to fewer community resources, right? Because even though they're living above just above the poverty line, they're going to have less resources because they're not considered living in poverty, right? Which client is at the highest risk for health outcomes related to poverty?
15-month-old infant
Yeah.
without medical history. Children.
Yeah. Did you guys get that right?
Yes.
Children are at the highest risk. We talked about that. And this particular child without a medical history. Who knows if they have immunizations, if they've had any checks, well checks?
Yeah, they should have had some kind of history if they had been going.
What should the school nurse expect for an impoverished adolescent? We talked about
Increase.
this with the homeless teens or the impoverished teens. Three
Decrease.
times likely to drop out of school. You guys remember talking about that in the last hour?
Yeah. Mm-hmm.
There's actually an increased risk of unintended pregnancy. They do not have good use of adaptive coping mechanisms, and they don't have improved attendance to extracurricular activities. All the other three answers are just the opposite. Right?
Right.
Okay, which client is the highest risk for homelessness? Why is it the veteran with PTSD living alone?
Because if he's having an episode, um, he's probably not tending to his finances the way he needs to, which will cause an eviction or a foreclosure and cause forcing him to
Well, he's
be
living
without a
alone
job.
too.
Yeah.
He's got nobody to look after him. At least A is living with a supportive family. C is living in a group home setting.
Mm-hmm.
An older child with history of suicidal ideations. Okay, there's no veterans are considered very high risk for homelessness anyway. Then you have a veteran with PTSD and lives alone. There's nobody to call or monitor, or so the veteran is at the highest risk for homelessness. And the last question, the nurse is working in an outreach clinic at a homeless shelter. Which client should be prioritized? Okay, so the important word is prioritized. Okay, this is another example of if there's more than one answer that could be correct, which there is, then please go back and read and see what you missed. Here, the important word is prioritized. Why is complaints of night sweats and unexplained weight loss a priority?
That's tuberculosis.
Tuberculosis.
And where's the setting?
Airway, breathing.
In a shelter?
And
In a shelter.
Large crowd of different people.
What's a high risk communicable disease in a shelter?
Tuberculosis.
What are and night sweats and unexplained weight loss could be symptoms of that.
Right.
Not to say that B doesn't need to be seen, C doesn't need to be seen, D doesn't need to be seen, but the question is asking who's the priority. So as you can see, all these questions are taking your knowledge and applying them to actual clients. So how'd you do?
Good.
For those of you that missed questions, was it? I think we went through every question in the last hour in our content, did we not? At least the information part of it.
All right.
Then it was up to you to apply it to the clinical setting.
I think I made a silly mistake though. I only missed one, but the one that I did miss, I seen the child without the medical history, but that 44-year-old working on the field, it just kind of ran through my head all of the stuff that he's exposed to, and that kind of threw me off a little bit.
But the
Remember,
15-year-old age makes a difference.
Children are the highest risk. That's
Yeah. That's what popped in my head.
Yeah. Okay, well, that's it for today. With a minute to spare, does anybody have any questions? Was this a helpful class?
Very much so.
Do you have a better understanding of the migrants and the rural population and a little bit more educated about the homelessness and people who live in poverty?
Yes.
Communities have a lot going on. All right, I'll stay out after for questions. You know how to reach me. Try to get, I need to I'm going to put out a message right now about changing my review to 9 a.m. Wednesday morning. Reach out if you need anything. Have a good rest of the week. Okay? And good
You
to
do
see
the same.
everybody. Have a great rest of the day.
You too.
All right. Bye, everybody.
Bye.
Bye.